Deaths due to substance misuse and suicide have been increasing for over 2 decades. But during 2020, we experienced the largest ever increase in such deaths in the US, up 20% in just 1 year. And since 2010, deaths due to alcohol, drugs, and suicide have increased by 77%. And we know that behind every death is a grieving family. These data demand our attention and immediate action. So during 2020, drug-induced deaths jumped by 30%, largely driven by increases in deaths caused by synthetic opioids and cocaine and psychostimulants. And these deaths really are a call to action for investment in harm reduction programs such as increased availability of fentanyl test strips and the overdose reversal drug naloxone. Tragically, deaths among young people, those are 17 years old and younger, due to drug misuse are also on the rise. And so to protect today's children, we need to ensure that all youth-serving programs, including the juvenile justice system, are prepared to serve all young people with programs that are trauma-informed and culturally and linguistically appropriate. The stress and the grief that COVID-19 has created in people's lives, it likely played a role in the increase in deaths due to substance misuse and suicide during the pandemic. But it's important to remember that these deaths have been increasing for decades. So we need to do much more than end the pandemic. We need to invest in programs that put children and families on positive pathways by addressing the social determinants of health. Programs that ensure access to safe and affordable housing, food security, healthcare services, and education and employment opportunities. Now, among all of this troubling data, there is some good news. There are evidence-based programs that we know can prevent substance misuse and suicide deaths. These programs address social and economic conditions that impact health and well-being. They support children and families and prevent adverse childhood experiences and trauma. They place mental health services in schools, and they ensure that everyone has access to mental health and substance misuse care. Communities of color are suffering disproportionate harm from the substance misuse crisis, and that's largely due to the long-standing social and economic inequities that communities of color experience. Deaths due to drug use among Black people increased by 41% between 2019 and 2020. And alcohol-induced deaths were highest among American Indian and Alaska Native people. So in response, we need to advance equity in mental health and prioritize investments and prevention programs in the most affected communities.
For the last 5 years, our partnership with Trust for America's Health has created a product that has helped us understand the trends around people that we lose prematurely to drug, alcohol, and suicide. We call it Pain in the Nation because we think our nation is in pain. And these lives lost, they're our friends, they're our family. And unfortunately, as this year's report shows, we continue to go in the wrong direction. 1 person every 3 minutes in this nation in 2020, we lost to drug, alcohol, or suicide. That's a 20% increase from 2019. But if we take it back 5 years when we first started this, we're looking at almost 100% increase of the number of lives that we've lost. This has got to change. Our report is a call to action. It's what we can do as a community to begin to address these issues. It begins with things that are really focused on each other. How do we show up? What do we say? How do we communicate with our friends and family who are suffering? And it extends into policy recommendations. What role can local, state, and federal governments do to address this scourge of epidemics that we're facing? A few themes emerged from this report that I do think are worthy of note. Number one, we have not been able to address some of the horrific issues around health disparities in this nation, and they continue. Black and brown communities saw disproportionate rates of increased suicide, increased drug overdose deaths, and it actually speaks more broadly to the policy solutions that we've been trying to pursue. They have not worked for everyone. One size will not fit all if we're going to truly address disparities. Number two, while we saw a slight reduction nationally in suicide, which is very positive, that was not a trend that was across the board. Disturbingly, we saw an increase in suicide amongst our youth. And this is one of those signs that we need to be paying a lot of attention to. Our youth are suffering. 2020 was hard for all of us, but I think it was harder for our youth, those that are in a developmental stage where they need their friends, they need their colleagues, they need those around them, and they didn't have it. And I think we're going to continue to see some of those trends play out if we don't do something more about it. When you look at this report, there's a lot of things that stand out that are surprising. But as someone who's been doing this for probably far too long, I can tell you the things that are most surprising to me is that we have not moved the needle in the right direction around drug, alcohol, and suicide. When I get to talk to folks all the time and I say, well, how are we doing? Or they ask me how we're doing, I have to unfortunately look at reports like this and show that we're going in the wrong direction. These are not just a data point. These are trends. These are trends that we have for 20 years, trends that go in the wrong direction and it continue to increase significantly. We saw a 20% increase in the lives lost to drug, alcohol, and suicide in 2020 compared to 2019. That's the wrong direction. So what's surprising to me is that we haven't done more. Unfortunately, I think we've become desensitized to these type of data. We become used to the fact that people are overdosing on the streets and we're not actually there able to provide the adequate programs or supports for them. And I think that that is a shame. I actually think it's a problem that we as a nation must face. So I'm surprised we haven't done more. I'm encouraged and I have hope that we will do more. And it's part of the reason why we do these reports. It's a call to action. It's a clarion call that there needs to be something more robustly done, more comprehensive, more integrated done to address these trends. Because these data are looking at 2020, we all remember what happened in 2020. This is when COVID came to our shores. And that immediately meant that we were in a place where we began to socially isolate, disconnect from our friends, our colleagues. Support systems are essential in how we are able to cope and get through tough situations, and we didn't have that. We also had many of us at home, not going to work. We have a lot more free time on our hands, and that leads to behaviors that sometimes are not healthy. When people are looking to cope with a major stressor like COVID was, sometimes we cope with inappropriate things, and some of us may lead to a place that becomes an addiction or a more chronic problem. So COVID caused a substantial amount of pain in our nation. It was also a multiplier. It highlighted the things that we already knew were a problem. People couldn't get access to care. Care was unaffordable or too costly for many. Care wasn't where we needed it. And especially when we weren't going to the doctor, we weren't showing up for our clinicians, we were at home, more people probably went without care that needed care. And that's something that only exacerbates these trends that we've been looking at since 1999. When you look at reports like this and you see 186,000 lives lost, one person every 3 minutes, immediately most of us are going to ask ourselves, well, what do I do if that's me or a loved one who's faced with this issue, who's confronted with the fact that somebody around them might be using a substance inappropriately, might be dealing with issues of suicide and thinking about taking their own life? What do you do? Well, the most important thing is you show up. You keep showing up. You're there for them. You let them know that no matter what they're going through, that you're there. There's power in presence. There's power in being in the room with someone when they're having a hard time. Listen, ask them how they're doing and be prepared when the answer they give you is something that's uncomfortable to you. It's number one. Number two, we have to continue to advocate for robust policy change that allows for our loved ones to get what they need. I used to say all the time that public policy was someone else's responsibility. It is not. It is all of our responsibilities. And so beginning with what it looks like to talk to each other and to show up for each other, we need to immediately move to action in public policy. Talk to your local leaders, from your mayor to your county commissioner to your school board to your members of Congress. Let them know how important it is to address issues of mental health and addiction. Let them prioritize this through their work. By you highlighting how important it is and using data like the data that we have in this report that's specific to you and your state, we can together begin to make a difference. Since 1999, we've been tracking data around drug, alcohol, and suicide deaths, lives that we've lost prematurely. These data continue to spiral out of control, go in the wrong direction, where we're finding that in 2020, there was 186,000 lives that we lost to drug, alcohol, or suicide. This is one person every 3 minutes. These are friends, these are family members, these are coworkers. This issue has become so pervasive that it's got its own name, deaths of despair. People are dying because they're in despair and they're needing help or support. Pain in the Nation report highlights the data. It gives us individual breakdown according to our states. It shows us these trends, but more importantly, it highlights what we can do, how we can collectively take action and move to a place that we can reverse the trends once and for all. In order to reverse these trends, there's 3 things that we can do. And the first is the most obvious because it begins with us. Conversations at the dinner table normalize mental health and addiction. Make it okay to talk about this with your family and loved ones. Number two, we have to bring care to where people are. We have a fragmented delivery system that makes it too difficult for people to find access to care. Let's bring mental health and addiction services to our libraries, to our schools, to our primary care settings, to all the places that people show up. And number three, let's prioritize prevention. We've unfortunately underinvested in our public health infrastructure in this nation. Prevention is a word that should be on everyone's minds, and it's not. And I think we've experienced that during COVID. So we need to invest more robustly in our public health infrastructure, and that begins by prioritizing prevention.